Does life begin in the womb, a petri dish, or both? In vitro fertilization, also known as IVF, is a procedure that was introduced in 1978 and is a method that provides people with the ability to create embryos by combining eggs with sperm outside of the body. The embryos are then placed in the uterus, and people who were unable to conceive a child can now do so. IVFs have redefined the ability of humans to procreate. An IVF procedure involves buildings, medical equipment, and staff to operate the IVF laboratories and storage facilities, making the IVF process very costly. The dilemma, therefore, quickly becomes what is the status of those retrieved but unused embryos? Who owns them, and what do medical storage facilities do when the creators no longer want the embryos or can no longer afford storage fees to preserve them? Basically, there are three paths for unclaimed embryos: destruction, donation for research, and donation for reproductive use. Each path requires ethical decisions. The Alabama Supreme Court addressed these questions from the perspective of the non maleficence pillar. In the case of LePage versus the Center of Reproductive Medicine, the Alabama Supreme Court considered the legal ramifications for the destruction of embryos created through IVF. More specifically, on February 16, 2024, three couples underwent IVF treatment at a fertility clinic in Alabama, and through the treatment, the couples became pregnant and gave birth to healthy babies. As is typical during IVF treatments, they produced additional embryos that were not used. Consequently, the additional embryos were frozen and preserved by the fertility clinic that assisted with the IVF process under the presumption that the couples could later return and have another IVF cycle using the frozen embryos. This would prevent the couples from having to go through the painful process again. At some point, a patient of that hospital entered the fertility clinic and opened one of the tanks in which the frozen embryos were stored. When the patient grabbed some of the embryos, he burned himself and dropped the embryos. They hit the ground and they were destroyed. The couples then filed a lawsuit against the hospital and the clinic under the Wrongful Death of a Minor Act. The Wrongful Death of a Minor Act allows the parents of a deceased child to bring a claim seeking punitive damages when the death of a minor child is caused by the wrongful act, omission, or negligence of any person. In allowing the parents to file a lawsuit under the Act, the Alabama court said the Act applies to all unborn children without limitation, and that includes unborn children who are not located in utero at the time they were killed. As a result, the court determined that the embryos are considered children or people. The Alabama court focused on the non maleficence approach to medicine, which begins from a do no harm perspective and requires healthcare professionals to avoid causing harm to their patients, whether through their direct actions or by their failure to act. The Catholic Church has also taken an early position on this issue. In 1987, the Sacred Congregation for the Doctrine of Faith issued a document known as the Donum Vitae, the Gift of Life, which addressed the mortality of IVF. In fact, the Catholic Church has determined IVF to be immoral. To reach this conclusion, the Catholic Church highlighted the principles considered in not only the non maleficence approach, but also the beneficence. The beneficence pillar can lead to ethical dilemmas. For instance, with respect to IVF treatments, there are questions about when life begins, whether science should intervene to create life, and what should medical professions do with unclaimed embryos. According to the Catholic Church, although a little baby may be born because of IVF, other lives are destroyed in the process. The scientific community has a different viewpoint. Neuroscientists study the brain, which enables conscious life. Thus, they strive to define life at the point of brain development and function. The scientific community epitomizes the autonomy and justice pillars of biomedical ethics. The autonomy pillar of biomedical ethics is based on the notion that individuals have the right to make decisions about their bodies, healthcare, and lives. Thus, individuals wanting to start a family should have the right to undergo IVF to achieve their goal, as well as the right to disregard the unused embryos. Individuals should also be free, under autonomy, to donate their embryos to scientific research. Scientists also abide by the justice pillar when it comes to IVF. More specifically, scientists operate under an internationally recognized ethical limit called the 14-day rule. Under this limit, scientists have agreed to never allow embryos to develop beyond 2 weeks in their labs. These differing viewpoints serve as a check and balance system on moral and scientific perspectives. As IVF become more available to individuals seek to conceive at more advanced ages and or conception cannot occur naturally, scientists strive to improve the IVF process. These facts may cause one viewpoint to overcome another. The path of unclaimed embryos raises an important question. about the boundaries of medical intervention, balancing technology advancements with respect for human dignity, autonomy, beneficence, non-maleficence, remains a constant challenge in the ongoing debate over IVF. Certain factors remain constant with respect to the ethical questions regarding IVF. Technology will continue to advance and scientists will continue to push the boundaries of medical intervention, and there will be many differing moral, political, and social opinions when medicine should intervene in the creation of potential destruction of life. And the dilemma of the unclaimed embryos will only intensify. Individuals are confronted with medical advancements that allow them to have families, avoid genetic issues, and use unclaimed embryos for research. So when does life begin? The answer lies in one or more of the four pillars of biomedical ethics.